My name is Dr. William T. O'Connor Jr. I am the inventor and practitioner of the O'Connor technique. And this is a person who has experienced the O'Connor technique and had a back pain problem. My book's name is Making Your Bad Back Better. Do you think you're making your bad back better?
Oh, there's no doubt about it.
Did you have that problem for years?
Yes, I did.
Since I did my maneuver on you, a lumbar back pain maneuver, that was alleviated. It's no longer, right now as you sit here, you don't feel that. When you're walking out of here, you don't have that same feeling, do you?
No.
Okay.
No.
How long had you had back pain?
I'd say a year and a half.
I never had any pain relief until I had the manipulation done by you.
He's had a history of back problems that goes back a number of years.
I was absolutely astonished when I stood up and I was virtually pain-free within, that 1 hour treatment. When I stood up, that pain that prevented me from actually walking in your door, I walked out of your door virtually pain-free, and I was absolutely amazed by what was accomplished in that session.
How long were you in pain? We're talking 7 months before I saw you,
Yes.
and another month maybe, or something like 8 months you were in pain?
Right.
Before?
It felt like I would sit down for a minute and it would make my body jerk back and forth like it was getting a shock of 110 through the outlet because, and I never knew when it was coming.
It was painful to do that,
Yes,
wasn't it?
yeah,
You couldn't really even walk without pain, or sit.
If I walked in the mall with my wife, my leg would kill me and I needed to sit down. Yeah, and I couldn't even actually drive sometimes. When I got up, it was like a breath of fresh air. I could not believe that I had no pain.
Right. And instantly,
I can hear the click.
instantly the pain goes away.
Yeah.
It's not an illusion. It's not. Was it painful?
No.
It was very, gentle and slow?
Right.
And carefully done?
Right. It was basically based on my pace.
There's no doubt about it. I don't experience the pain that I had for 25 years. Hardly ever.
People all over the world are suffering from this condition and haven't a clue as to what its cause or remedy is.
If anybody out there has any back pain and they haven't found the answer yet, I would strongly encourage them to contact you because it changed my life.
And can you represent to the world that the O'Connor technique relieved your back pain?
Yes.
So not only was the O'Connor technique able to take you out of pain almost instantly, if you do you concede or consent that is an accurate representation? It was instantaneous, practically. Within a day you were better.
Oh yeah.
After our maneuvers.
Yes.
The knowledge that I imparted to you and the what I taught you and what I did took you out of 25 years of back pain.
Yeah.
And that's not an exaggeration then, is it?
No, it's not an exaggeration at all.
The information that I gave you about the O'Connor technique have a clear understanding of what caused the pain and how to prevent it?
Yes. That's one of the biggest things, is that it made sense the way you showed me and explained it. It made sense, and I could understand where the pain was coming from and why, and now I understand how to get up out of bed correctly or shower correctly and drive with the right posture and things to avoid it. You can tell when your back is out or the piece of disc material is displaced, correct? Yes.
The result of the introduction to the O'Connor technique, that you understand the source of your low back pain, how to stop it and how to prevent it?
Yes.
Do you feel that it's common sense enough and easy enough to manage yourself that if this were employed on a large scale, it would dramatically reduce the back pain in the population?
No, I have no doubt whatsoever. I know from personal experience that that's how it's changed my life and taken away the pain that I had.
Right.
And I think had I not had it done, I too would have lingered in that kind of a situation for an extended period of time, probably resorted more to medications.
But what I did was give you the way to basically become your own physical therapist.
Yeah.
You can find when your back is out and know where it is out and do a maneuver now to put it back in, correct?
Yeah, and that's another thing that I love so much is that you show us how to do that. You just don't throw us on a bed and crack us without us having any knowledge. You helped me by showing me how to do things, telling me why you're doing this or why I'm doing this, and you made me figure it out with the help of you.
It doesn't seem like, what is this going to do to fix my problem? You know, I've been to chiropractors, I've had medication, that sort of thing, but at the time I just didn't understand how that was going to make a difference. And there's nothing like standing up and going from completely in pain and agony and barely able to function and standing up and being pain-free. And it is a moment in time that I won't forget. It is an experience that I won't forget.
I've been through, I would say, a total of probably 20 doctors.
Yeah. So I fixed you for probably less than a single emergency room visit. And you are now going back to work now?
Correct. And you know, I suggest that you come and you see Dr. O'Connor.
Is my technique less violent than a chiropractor's?
Oh, absolutely. The major difference between the O'Connor technique and what a chiropractor does is that a chiropractor will give you sudden violent movements, twists, or, you know, manipulate you to where, you know, you feel a pop maybe and you think, oh yeah, that's relief and whatnot. But the O'Connor method is more of a systematic, continuous movement, but it's a gentler movement which is made to ease the disc back into its natural position and not suddenly and violently invoke a reaction. Your body's not designed for that. And once you understand what your problem is and it's explained to you what simply has to be done, it makes a lot of sense. It made a lot of sense to me, so I had no skepticism.
You'd been to 4 emergency room doctors,
Correct.
A bunch of physical therapy,
Correct.
And the orthopedist, and none of them either didn't know or didn't feel you deserved the explanation of what was the source of your pain.
Correct.
But now you know it.
I know it.
Do you think, knowing what you know now, that a chiropractor could really fix your back or put your disc back in using their method?
No. They don't take the time out to stretch you.
Right. And you believe that the average person can alleviate their own back pain with the O'Connor technique?
Yes.
And that the self-diagnosis part of it and the anatomical education is free.
Once you know where their problem is, which way the disc is bulging out, whether it's the right side, the left side, and you've dialed that in by your first examination, then you know exactly which maneuvers to apply, and they're all addressed in your book and the website.
A person who is introduced to this method would save themselves an enormous amount of money, pain and suffering, and disability from work or their normal actions of daily living that they can't perform because of the pain. Do you think it's worth a reasonable amount of money to pay for, like, say, the website, $30? Do you think that's outrageous?
Not at all.
Can you think of anything cheaper than what I did?
No, I think for the amount of time and the financial investment was very small compared to the reward. Absolutely.
Right. I mean, a prescription of Vicodin practically is what it takes to buy my book. Mm-hmm. You know what I mean? And to get my website. If somebody told you that $30 I could take it away, how much money would you have saved?
Oh, the chiropractor's $45 a visit, and
Right.
they tell you, well, if this is going to work, I need to see you every week for 3 months or 4 months.
Did you think that you were exposed to any dangerous process or any scary risk of damaging you?
No, we only moved me in ways that my body would move
ordinarily.
Right.
I believe that the average woman with pregnancy-related back pain, the pain that comes from lifting a child or carrying that weight in front of them, could learn this technique and alleviate their pregnancy-related back pain?
Oh yeah.
by using that website, do you think that the $30 they would spend on that is a good investment? Because if you do, you can do this even without me having to put your discs back in?
Absolutely, you can do it.